Hi everyone. I'm going to do my HIPAA prevention on proper disposal of documents. It's the most basic, but the most common thing I've seen um, working as a nurse. My name is Michelle Halby, and this is part of our module 4 in discipline healthcare. So who am I? As I said, my name is Michelle Halby. I work on the transplant step-down floor. We basically are responsible for caring for solid organ transplant recipients, providing monitoring, education, and coordination. What's the prevention strategy that we're going to do? Very basic. Proper disposal of documents. You shred all the paper containing personal healthcare information. Don't put in the regular trash. Keep all their printed information that we're using, for example, our care plans, our shift reports, all secure until it is properly shredded. If it has a name, a date of birth, an MRN, medication associated with them, it should go in the shred bin when we're done with it. And don't leave printed documents. For example, their AVS, after the summary is asked for discharge, just laying on the nurse's station, up where anybody can see it just walking around or grab it. Why is this important to properly dispose of healthcare information? This will prevent the PHI from seen by unauthorized personnel, people, clients, avoid accidental exposure in trash cans or public areas. It's a very common cause of breaches, as was stated in therapy notes. Why is it so important? Patient information is sensitive. Privacy is a basic medical right, and this handling of PHI disrupts system quality. She and Singh emphasized that protecting patient information is necessary to maintain quality, safety, and trust within the healthcare system. Our patients trust us to take care of them, keep them safe, affect the system of. So it impacts the 4 Ps of healthcare: patients, providers, payers, and policymakers, according to Rich and colleagues. So basically, a HIPAA violation will affect all of these four Ps, um, disrupting communication, damages trust, and can have system-wide consequences. These financial consequences, HIPAA violations are very costly. These fines will strain the budget. The budget will be back to us. Fewer resources for staffing and equipment. Healthcare economics, they do involve trade-offs. Boundless Crash Course in Center Medicine pointed these factors out. Any program interpretation is very, very important. We are responsible for protecting our community's trust. Any program relies on reputation. We lose a reputation, we can really hurt our program. Privacy breaches, they damage that confidence. Trust in our program that we will provide safe, coordinated care keeps our program alive. In closing, HIPAA is there to create ethical, safe, responsible care. We are responsible for proper disposal to protect our patients. We have to support consistent quality and trust. We need to prevent the financial strains and strengthen our program's reputation. One thing, too, I'd like to mention that I found really important in my previous medical careers as a nuclear medicine technologist and primarily a medical technologist, we did a way better job than nurses it is so much stuff that we actually throw away that we put in the trash that we could get dinged so much. And it's not just one person, it's everyone, which is really kind of scary. So if we do our part to make sure that we throw away all our information from the medications administered, from the baggies that have the patient's label on it, we can do a part to really make a difference.